Hey there, welcome back to our channel. Today, we're about to dive into a topic that affects millions of people around the world. Snoring. Whether you're someone who snores or you share your bed with a snorer, you're in the right place. In this video, we'll unravel the mysteries of snoring, exploring why it happens, its impact on health and relationships, and most importantly, how you can put an end to those nightly symphonies. So, if you've ever wondered what's behind the sound of snoring or you're desperately seeking solutions, stick around because we've got you covered. Now, let's get started and uncover the secrets of snoring. Introduction. Snoring is characterized by the raspy or grating noise produced when air moves through relaxed throat tissues, resulting in vibrations during breathing. While snoring is a common occurrence for most individuals at times, it can develop into a persistent issue for some, potentially signaling underlying health concerns. Furthermore, snoring can be bothersome to one's bed partner. Symptoms. Snoring is frequently linked to a sleep disorder known as obstructive sleep apnea, OSA. While not all snorers have OSA, the presence of any of the following symptoms alongside snoring may indicate the need for a medical assessment. Observation of breathing interruptions during sleep. Excessive daytime drowsiness. Difficulty maintaining focus. Morning headaches. Waking up with a sore throat. Restless sleep. Nighttime gasping or choking. Elevated blood pressure. Nighttime chest discomfort. Disruptive snoring that interferes with your partner's sleep. In children, poor attention span, behavioral problems, or decreased school performance. Causes. Several conditions can influence the airway, contributing to snoring. Mouth anatomy. Having a low, thick soft palate or excess throat tissues due to being overweight can narrow the airway. Similarly, an elongated uvula, the triangular tissue hanging from the soft palate, can obstruct airflow and increase vibration. Alcohol consumption. Excessive alcohol intake before bedtime can induce snoring by relaxing throat muscles and reducing the body's defenses against airway blockage. Nasal issues. Chronic nasal congestion or a deviated nasal septum can play a role in snoring. Sleep deprivation. A lack of sufficient sleep can lead to further relaxation of throat tissues. Sleep position. Sleeping on your back often results in more frequent and louder snoring, as gravity's effect on the throat narrows the airway. Risk factors. Several risk factors may contribute to snoring, including gender. Men are more prone to snoring and sleep apnea than women. Weight. Overweight or obese individuals are at a higher risk of snoring and obstructive sleep apnea. Airway structure. Some people may possess a long soft palate, enlarged tonsils, or adenoids, which can constrict the airway and lead to snoring. Alcohol consumption. The consumption of alcohol relaxes throat muscles, increasing the likelihood of snoring. Nasal problems. Structural abnormalities in the airway, such as a deviated septum or chronic nasal congestion, can elevate the risk of snoring. Family history. Having a family history of snoring or obstructive sleep apnea can be a potential risk factor, suggesting a hereditary influence. Complications. Chronic snoring may have more significant implications than being a mere annoyance. In addition to disrupting the sleep of your bed partner, if snoring is associated with obstructive sleep apnea, OSA, you may face the following complications. Daytime sleepiness. Frequent irritability or anger. Difficulty concentrating. Increased risk of high blood pressure, heart conditions, and stroke. Elevated risk of behavioral problems in children with OSA, such as aggression or learning difficulties. Greater risk of motor vehicle accidents due to sleep deprivation. Treatment. When addressing snoring, your healthcare provider will typically begin with lifestyle modifications, which may include weight loss. Avoiding alcohol close to bedtime. Managing nasal congestion. Ensuring adequate sleep duration. Changing sleeping positions to avoid lying on your back. For snoring accompanied by obstructive sleep apnea, OSA, your healthcare professional might recommend Oral appliances. These are custom-fitted dental mouthpieces designed to reposition your jaw, tongue, and soft palate to maintain an open airway. The fit and positioning of the appliance will be optimized in collaboration with your dental specialist, and your sleep specialist will monitor its effectiveness. Regular dental checkups, typically every 6 months during the first year and then annually, are necessary to assess the fit and your oral health. Potential side effects may include excessive salivation, dry mouth, jaw pain, and facial discomfort. Continuous positive airway pressure, CPAP. This method entails wearing a mask over your nose or mouth while you sleep, which delivers pressurized air from a bedside pump to keep your airway open during sleep. CPAP is particularly effective in treating snoring associated with OSA. However, some individuals may find it uncomfortable or have difficulty adapting to the machine's noise and sensation. Upper airway surgery. Various surgical procedures aim to widen the upper airway and prevent significant narrowing during sleep through different techniques. For instance, uvulopalato-pharyngoplasty (UPPP) involves tightening and trimming excess throat tissues under general anesthesia. Maxillomandibular advancement (MMA) repositions the upper and lower jaws forward to open the airway. Lifestyle and home remedies. To prevent or minimize snoring, consider the following suggestions. Weight management. If you're carrying excess weight, shedding pounds can be beneficial. Extra throat tissues in overweight individuals can contribute to snoring, and weight loss can help alleviate this issue. Sleep on your side. Sleeping on your back can cause your tongue to fall backward into your throat, narrowing the airway and obstructing airflow partially. Try sleeping on your side instead. If you tend to switch to your back during the night, you can sew a tennis ball into the back of your pajama top to discourage this position. Elevate your bed's head. Raising the head of your bed by approximately 4 inches may be helpful. Nasal strips or external nasal dilator. Apply adhesive nasal strips to the bridge of your nose to expand your nasal passage, improving your breathing. Alternatively, consider an external nasal dilator, a stiffened adhesive strip placed externally across your nostrils to reduce airflow resistance and make breathing easier. It's important to note that these remedies are not effective for individuals with obstructive sleep apnea, OSA. Address nasal congestion or blockage. Conditions like allergies or a deviated septum can restrict airflow through your nose, leading to mouth breathing and an increased likelihood of snoring. Consult your doctor if you have chronic congestion. They may recommend a prescription steroid spray. Structural issues like a deviated septum may require surgical correction. Limit or abstain from alcohol and sedatives. Avoid consuming alcoholic beverages within 2 hours of bedtime, and inform your doctor about your snoring before taking sedative medications. Alcohol and sedatives can depress the central nervous system, causing excessive relaxation of muscles, including those in the throat. Quit smoking. Smoking cessation can reduce snoring and offer various other health benefits. Prioritize sleep. Aim for at least 7 hours of sleep per night as an adult. Children's recommended sleep hours vary by age, with preschool-aged children needing 10 to 13 hours daily, school-aged children requiring 9 to 12 hours, and teenagers benefiting from 8 to 10 hours of sleep each day. Well, there you have it, folks, the comprehensive guide to understanding, managing, and ultimately conquering snoring. We hope you found this video informative and insightful. If you or someone you know has been dealing with snoring issues, remember that you're not alone, and there are plenty of strategies and treatments available to help you get that well-deserved, peaceful night's sleep. Don't forget to hit the like button if you found this video helpful, and if you haven't already, please subscribe to our channel for more valuable content on health and wellness. As always, we appreciate your comments and questions, so feel free to share your thoughts or experiences with snoring below. We'll do our best to provide you with answers and support. Thank you for joining us today, and here's to many nights of restful, snore-free sleep. Until next time, take care and sleep tight.